Hi everyone. Thank you again for tuning in today, and thank you IPC for having us today. Once again, this is Christine sitting next to me. My name is Megan. We're both registered nurses. We're both sexual health clinicians. Today we're going to be presenting on tips and tools for managing sexual changes and enhancing intimacy following prostate cancer treatment. So we'd first like to introduce our program. Christine and I are part of the Prostate Cancer Supportive Care Program, or PCSC for short. We're located in Vancouver, BC. Our program is currently made up of 8 modules, and you can see them listed on the screen there. Christine and I specifically work within Module 2, which is managing the impact of prostate cancer treatments on sexual function and intimacy. So in this presentation, we're going to review different types of intimacy and all the different aspects of sexuality. And then we will review the sexual consequences of prostate cancer treatment and different management approaches. And then lastly, we will talk about how to enhance intimacy. Okay, first, let's have a look at intimacy. Intimacy is an umbrella term for that affectionate or loving personal relationship that you have with another person. So it's that closeness that you feel with someone. There are multiple dimensions that make up intimacy, and it can be something that's very powerful to, share with someone else. So we're just going to go over a few. First off, we've got our intellectual intimacy. So, this is a rich meeting of the minds. They're about your thoughts, your ideas, the way you connect with someone on your values. Next, we've got experiential intimacy. So this is the closeness that you share in activities that you do together. It could be hobbies, special activities, maybe classes that you take together. Then there's sexual intimacy, which is our practices of sexual relations with a partner. And then, last but not least, we have emotional intimacy, which is how you support each other. It's about being vulnerable, having feelings of closeness and trust, safety. So, as you can see, there are many ways of being intimate with your partner, and it is important to communicate what dimensions of intimacy are important to you and how to maintain that closeness throughout your relationship. On our slide, each bubble is the same size, but in reality, this can actually vary from person to person. And what that means is the meaning that people will place on, different bubbles will be different. So each bubble can have a different degree of importance, essentially, and that's completely normal. So now we'll take a closer look at sexuality, as there are many different facets. Sex is what we do, and sexuality is the essence of who we are as unique individuals. It's about how we express ourselves, what brings us joy, what brings us pleasure, and it encompasses all the feelings, attitudes, and behaviors that contribute to our sense of self. So what you're seeing on the screen here is called the Wheel of Sexuality. It shows the diversity of our sexuality. So we're not going to go into detail of every single element today, but we would encourage you to look at the words on the screen, and maybe you can ask yourself, what influences your sexuality? What makes you feel like a sexual person? And we just think it is important to recognize where our feelings of sexuality come from, and to understand that it can be made up of many different components.
All right, so you probably heard of or already experienced that treatment for prostate cancer can affect your sexual functioning. On top of that, everything listed on this slide can also be consequences of treatment, and they can change your usual pattern of being sexual and feeling close with your partner. When your usual pattern of being sexual has changed, this requires adaptation. Over the next few slides, we're going to go over more specifically the mechanisms of erectile dysfunction from prostate cancer treatment. So we've broken down the different causes of ED after prostate cancer treatment into 3 different parts. 1, the nerves that help cause erections can become injured. The muscles in your penis can become fibrotic or less healthy over time. And 3, the arteries which bring blood into the penis become damaged, which stops the penis from receiving adequate blood flow. So let's look at these in a little bit more detail. Okay, first we're going to talk about nerve injury. So this is this diagram here actually shows the nerves that are important for creating erections. They're shown here in yellow, and they're called the cavernosal nerves. They start at the spinal cord and run down the back of the bladder, wrapping around the prostate and into the penis. The cavernosal nerves are very close to the prostate, essentially a cell layer away, which is why any treatment for prostate cancer can cause damage to these nerves. So let's take a closer look at the various prostate cancer treatments and how they can affect those nerves. With surgery, the primary goal is to remove the cancer. If the surgeon is able to, they will try to spare those cavernous nerves. This is called a nerve-sparing surgery. It's not always possible to spare the nerves, though, depending on the characteristics of the cancer. You can also have issues with erectile dysfunction even if those nerves are spared. The nerves are very, very sensitive and can enter into what we call a shock phase called neuropraxia. In that shock phase, they aren't working anymore, and it can take up to 2 to 4 years for the nerves to heal and come out of that shock phase. Your body actually has the final say of how it's going to recover. Next, let's talk about radiation. So radiation eliminates cancer cells by directly destroying the cells or by damaging their DNA. For external beam radiation, the red area in the top right picture is the prostate receiving the highest dose of the radiation. The green area, which includes those cavernosal nerves, receives a smaller amount of radiation, about maybe 40% of the dose. Other areas in the pelvis which will be affected, including the bladder and the rectum, which is why many patients have other side effects after receiving radiation therapy. For brachytherapy, this involves the placement of radioactive seeds directly into or close to the tumor using needles, wires, and catheters to destroy the cancer cells. The region surrounding this may be affected, including those nerves.
So next we'll talk about muscle fibrosis. So prostate cancer treatment can cause the muscle within the penis to become more fibrous and less healthy over time. So it kind of loses that ability to expand and relax the way that we would expect it to. Around the penile muscle, there is a sheath of tissue called the tunica. You can think of it like a layer of saran wrap. Normally, when the penis fills with blood, the muscle expands and it closes off the blood vessels against the tunica. This is what actually keeps the blood in the penis to maintain an erection. When the tissue becomes more fibrotic and it doesn't have that ability to expand against the tunica, that's what prevents the blood from staying in the penis. And this is what we actually refer to as venous leak. Okay. So just to paint a different picture, like imagine you're going for a bike ride and you need to fill air into your bicycle tire. If the valve isn't sealed properly, no matter how much air you try to pump into the tire, the air is not going to stay inside and the tire will be soft. So that's the same idea with venous leak. You might have good blood flow going into the penis, but if you can't seal off the veins, which are like the exit highways, then the blood simply returns back into the body, causing the penis to become flaccid or soft again. Lastly, we'll talk about compromised arterial inflow. So to form a rigid erection, you do need to have good blood flow going into the penis. Prostate cancer treatment can cause the blood vessels inside the penis to become damaged. This can limit the blood flow going into the penis, causing erectile dysfunction. If this occurs, you may require treatment to ensure your penis gets enough blood to stay healthy. Compromised arterial inflow may be reversible depending on the treatment and the amount of damage.
Okay, so adapting to these sexual changes can be challenging. It's important to reflect on these 4 principles to help you move forward. Having acceptance in how things may have changed in your functioning or in your relationship. Being flexible and trying new things and having change. And then remembering to have patience and persistence. So how many people here have learned how to ride a bike the very first time they sat on one, or learned how to drive a manual on the first try? I'm sure most of us have fallen off or gotten back up or stalled that car and turned it back on. It takes patience and persistence to learn and adjust to something new, just like anything in life. Next, we're going to talk about some of the different pro-erectile therapies that you can try, and then we can cover some tips around intimacy. Okay. Okay, so we're going to move forward and talk about some of these ED treatments. The oral therapies or pills inhibit a certain enzyme in the body known as PDE5. This enzyme is present in the cells lining the smooth muscle tissue in the penis. When we inhibit the enzyme, it causes the smooth muscle to relax more and allow blood into the penis to cause an erection. So usually the first thing men usually try are the oral therapies, as they are considered one of the easier and least invasive therapies. They all work similarly, as they are the same type of drug. However, some men respond better to one than another, or you may have side effects with one and not another. So it's good to try them all, not at the same time, but it is good to try them all to see which one is most effective for you. One thing to consider if you use nitro spray or take blood pressure medication or have low blood pressure, the PD5 inhibitors may not be appropriate for you. Always talk to your doctor before trying these medications. Also, what's important to consider is your nerve function, your level of testosterone, and where you are in your recovery pathway. If your nerves are still healing or removed, the pills might not be effective. If you're on androgen deprivation therapy, the PD5 inhibitors may not be effective as they rely on the testosterone. That being said, Megan and I, we've both had men on ADT and who've had no nerve sparing surgery, and they still respond to the pills. So it doesn't hurt to try. Some of the PD5 inhibitors are short-acting and some of them are long-acting. The short-acting ones are Viagra, Levitra, and Staxin. They only stay in the body for up to 8 hours. The long-acting PD5 inhibitor is the Cialis, and that can stay in the body up to 36 hours. That doesn't mean a man has an erection for 36 hours. It just means that when he chooses to be sexual, he'll have access to the medication in his body. It's really important to know that you need to have good sexual thoughts and stimulation after taking the pills. You can't just take the pill and begin reading the newspaper expecting an erection to develop. Potential side effects of the pills include indigestion, facial flushing, nasal congestion, headache. Sometimes there could be vision changes, which are more related to Viagra, and sometimes there can be muscle cramping or hearing changes, which is more related to Cialis. Viagra and Levitra are significantly affected by fatty foods and alcohol. So if you're going to have that steak with a glass of red wine, it's really important that you wait at least 2 hours before you take that pill, or you can just simply take the pills on an empty stomach. Always ask your urologist or family doctor for samples, as they can be quite expensive. And double check if you have an extended healthcare plan. Sometimes there might be some benefits that might partially cover these medications. So next, I'm going to talk about Muse. Muse stands for Medicated Urethral System for Erections. It's a tiny pellet or suppository about the size of a grain of rice, which is administered into the urethra. That's the same area where the catheter would go. And you administer the Muse with an applicator. It looks like it might be uncomfortable, but it's actually quite well tolerated. However, the medication is not commonly used in Canada. It is quite expensive. One dose ranges between $40 to $70. And it's not covered by insurance. And what we find is that when that medication is available, maybe it might only work between 30 to 40% in men. If it does work, it can create a good quality erection in about 10 to 15 minutes. It's not appropriate for all patients because if you have urinary incontinence, then what can happen is that the urine might push that suppository out. Side effects can include some irritation to the urethra, and if the medication is passed on to a partner's vagina or rectum, that can cause a little bit of irritation as well. There is another product called intraurethral gel, which can contain between 1 to 4 medications. Again, this would not be a good intervention if you had urinary incontinence. What we're finding with the intraurethral gel, it's not overly successful in creating erections, and it tends to be quite expensive. So next thing I'm going to talk about is the penile injections. And this is actually one of the most effective ED treatments, about 90% effective, and one of the most affordable therapies. Penile injections are not reliant on nerve function, right? Or signals coming from those cavernosal nerves or testosterone levels. It is a local response where you inject a small amount of medication into one side of the penis, which causes a smooth muscle in the penis to relax, causing blood to flow in to create that erection. Usually after the injection, the erection will develop within 5 to 20 minutes, and the goal is having it last between 30 to 60 minutes. What we find is a lot of men are really hesitant to try penile injections as they're afraid that it'll be painful, or many people just don't like needles. Megan and I will say that, the needle itself is quite small and most men don't even feel it. The most challenging part of the injections is the psychological aspect of being comfortable with the technique. In our clinic, we actually do one-to-one teaching, which could be either virtual or in person. We discuss how the medication works, how to draw up the medication, different ways of holding the penis to do the injection. We also show how to actually do the injection and the dosing of the medication. Possible side effects can include priapism, which is a prolonged erection, or scarring of the penile tissue. The incidence of developing any of these side effects is actually really quite low.
Okay, so next I'm going to talk about the vacuum erection device. So you may have seen some of these in adult love shops or maybe even online. I had a couple of patients make like Austin Powers references, but I haven't seen the movie, so I'm not familiar with it. But yeah, if you do get a vacuum pump, we recommend using a medical grade vacuum erection device, just to prevent any damage to the erectile tissue and to make sure it's effective. If you purchase a device that's not a medical grade device, it might not have enough negative pressure, or it might have too much negative pressure. So when used correctly, the pump is about 80 to 90% effective. If you do purchase a pump, we actually recommend using it every day for the first 14 days. So this will allow you to like master using the device, like gain confidence with using it. And it also helps to recondition the penile tissue. So to use the pump effectively, you do need to have a good seal. The opening has to be pressed up right up against your body. And this can be accomplished by using a water-based lubricant and trimming back any pubic hair that might be getting in the way. So the nice thing about the pump is that it can be used for two purposes. You can use it for penile optimization, which is the term we use for what it means is like exercising the penis, basically. And you can also use the pump for sexual activity, whether that's by yourself or with a partner. Another nice thing about the pump is that you can use it with the pills, the PDE5 inhibitor. So, once again, that's Cialis, Viagra, Levitra, or Staxin. You can also use it with Muse, the intraurethral suppository, or penile injections, because the pump isn't actually, it's not medication itself. So it's okay to use in combination with other medications. The pump works by generating negative pressure. This is what actually pulls blood from the veins and the arteries into the penis, and that's what creates the erection. But once you remove the device and that negative pressure isn't there, the erection will fade. So if the goal is to, like, you're using it for sexual activity, you want to be able to maintain that erection, you do have to use a tension band. And you can see that on the screen, it's pictured that by that little pink band that's sitting at the base of the penis. So that's the tension band. Just one thing to note, if you do use a tension band, you can use it for a maximum of 30 minutes at once. So this isn't something that you want to put on and then fall asleep. Yeah, you want to make sure you take it off after 30 minutes. There are a few considerations when using the pump. The erection can look a little dusky blue in color. It might be a bit cool to touch when the erection is formed. This is because the pump is drawing blood from the veins, which doesn't normally happen with a natural erection. It's not harmful at all, but it can be a bit distressing or just a bit strange if you're not aware of it beforehand. If the temperature is an issue, you can use a lubricant to warm up the erection in your hands before intercourse. When using the vacuum pump and tension band for sexual activity, whether that's for self-stimulation or with a partner, you might notice what we call a hinge effect. This is because the blood is only maintained within the erection until the base of the penis where the band sits. It doesn't actually go deeper into the pelvis, into the root of the erection, the same way a natural erection would. So we would just recommend using a hand to guide the penis at least 50% of the way into whatever opening it's going into, whether that's a vagina, anus, mouth, toy, 50% of the way before engaging in activity or movement. And you might have to experiment with different positions with your partner. Okay. And last but not least, we'll talk about the penile implant. So the penile implant is a permanent procedure. Once you have the implant, you can't make the decision to go back to using the pills, the injections, the muse, or the pump. The benefits of the penile implant are that it takes 10 seconds to form a 100% rigid erection. About 90% of men say that they are satisfied with their penile implant. The surgery does last about 1 to 1.5 hours, and it is covered by our healthcare system, so it's 100% free of charge. There are different models of implants. The one that's pictured here on the screen is a 3-piece implant, and I think that's the most common one. Yeah. So there is a pump in the scrotal sac. There's a fluid reservoir in the pelvis. That's where it says saline reservoir there on the screen. And then there are 2 cylinders which essentially replace the erectile bodies in the penis. And they're represented there as this flaccid cylinder. So that's what we're looking at. Once healed, your doctor will show you how to cycle the device. Doctors will usually wait until about 2 years post prostate cancer treatment before discussing the implant, just to ensure that you've achieved like the best possible recovery for natural erections first, because, once again, this is a permanent procedure. So one thing to consider, the penile implant does not extend the length of the penis at all. So if you lift your penis out while it's flaccid, just away from your body, maybe with a little bit of stretch, that's about the size it would be when using the implant. Okay. So now that we've covered the different pro-erectile therapies, Christina and I will share a few strategies from the intimacy toolbox, we call it, for enhancing or restarting, that loving connection with, with your partner. If you are single, all of this can apply to you, in focusing on your own sexual health as well, or maybe for a potential partner. A lot of the time, couples can become focused on erectile dysfunction treatment because they really want to engage in intercourse again. And there's absolutely nothing wrong with wanting this, but it is important to remember that there are many different ways of enhancing intimacy within your relationship. And sometimes, expanding your focus will give you more opportunities to find, other things that work for you and your partner. Okay. So we'll start with communication, because it is the best way to enhance intimacy and increase sexual satisfaction within a relationship. Oftentimes we think we know someone so well that we can just read their mind, but this isn't true. And it is important not to assume how your partner feels, especially when it comes to sexual dysfunction. And this is just a funny comic. It's cute. Okay. Here are more reasons in support of communication. As mentioned earlier, it's the best way to enhance your sexual satisfaction after treatment. But in addition to that, sharing your thoughts and feelings can help both of you to process any changes and give you the opportunity to support each other. We like to say that prostate or bladder cancer is a couple's disease because the treatment can affect the partner just as much as the person with the cancer. It's also important to communicate just to ensure that you're both on the same page in terms of how you actually want to move forward with sexual adaptation. So how do we actually go about doing this? Think about what is important to you and your partner. So, set aside some time together, have a private conversation where you can talk about your thoughts and how you actually want to make changes. Make sure you ask your partner, what they're thinking, how they're feeling, and then take some time to acknowledge that as well. For some couples, it can be a bit of an uncomfortable conversation. Some people might find it easier to write a note or pen a letter to their partner to discuss their needs. And sometimes it can be helpful to have a third party involved. So, for example, seeing a relationship counselor or a sex therapist together. Those professions, they can be really helpful in opening or just like starting the conversation and then getting you on track to enhancing intimacy.
Okay, so now coming back to our toolbox, let's take a closer look at an activity called Sensate Focus. So Sensate Focus is an activity for exploring touch and accessing different feelings of pleasure. It was developed as a way to help couples learn about themselves and each other and to move forward towards more fulfilling intimate relationships. The aim of Sensate Focus is to build trust and intimacy within your relationship, helping you to give and receive pleasure. So let's look at this in more detail. There's actually 3 different phases of Sensate Focus. The first phase is known as the non-genital sensate focus. This is touching, rubbing, squeezing, stroking, or kissing anywhere on the body except the breast and genital areas. If you are the giver, start with your partner's face and work from head to toe. Take your time and explore every area of your loved one's body. The goal is to experience the sensation of touching and is not meant to sexually arouse your partner. After 15 or 30 minutes, you can switch roles. Stay in phase 1 until you both are ready to move to phase 2. So phase 2 includes touching the whole body, including the breasts and genital areas, without attempting intercourse. Again, this isn't meant to lead to a specific arousal destination. The last phase is penetrative sensate focus. During this phase, you will engage in mutual touching, beginning with stage 1, then moving to stage 2, and then, if you are comfortable, getting into position as if you're going to have intercourse. Move your body so the partner's genitals can rub against yours. After 1 or 2 sessions, you can progress to full intercourse, or you can just continue with touching or oral sex that leads to orgasm. Sensate Focus can be a great way of enhancing intimacy, especially if it's been a while since you and your partner have engaged in any of those activities. So here's some tips for engaging in Sensate Focus. First of all, try not to talk during the activity. Use your hands to guide your partner. Choose a time and place acceptable for both of you where you won't be disturbed, and make the surroundings as pleasant as possible. Choosing music or lighting the area or putting on a nice scent, whatever is enjoyable to you. Try to enjoy the journey rather than aiming towards a specific destination. Don't rush anything. Oftentimes the slower you take it, the more you'll get out of it. And make sure that you're respecting each other's boundaries. Only move from one phase to the next if both partners agree.
Okay, so now we'll take a closer look at creating what's called a passion plan, which is just another activity or another way of enhancing intimacy. Sorry, I don't know what that was. A lot of people like to incorporate the Sensate Focus activity that Christine just talked about into their passion plan as well. But we'll take a closer look at this. So the passion plan is actually something that was developed by Dr. Cheryl Fraser, and it was designed to help couples recharge their romantic and sexual life. A lot of couples believe that, sex should be completely spontaneous without ever talking about it. Sometimes that works. A lot of the times, though, it doesn't. And especially after prostate cancer treatment, that pattern of how you communicate or engage sexually with your partner can change. So planning passion into your life can make your sex life better. It can enhance that closeness you feel together, and it can strengthen your relationship. So this is an example of a passion plan. So basically, you and your partner would set goals for creating more passion in your relationship, and you can do this anywhere. And it doesn't just have to be about sex, but that's just an example. You can plan daily, weekly, monthly, and annual goals to enhance your intimacy. And then, as you can see from the examples on the slide, it can be really anything that helps you feel closer to your partner. So some examples might include taking dance lessons together, trying a new sexual activity, massaging each other, or even going to a counseling session or some type of workshop together. Sitting down and creating the passion plan is a great opportunity to commit to being passionate together. It is important that you write it down, maybe leave it somewhere where it's easy to see, like on a fridge or on the nightstand. And really the message is that it's never too late to show your partner that you care about increasing that connection and really making a commitment to it.
Perfect. So now we're going to take a look at ways to enhance libido. That's that sexual appetite, as that is a common concern after having prostate cancer treatment, especially if you're on androgen deprivation therapy. So sometimes like treatments, like I just mentioned, the hormone therapy, age, pain, fatigue, depression, and other life challenges can change your sex drive, and that can make it challenging to be sexual with your partner. When that drive is low, or if you're having changes to your sexual functioning, initiating sexual activities can be, really overwhelming, and that sometimes you don't even want to start them. So one of the things that we always encourage people to remember is that appetite comes while we eat. It's the idea of starting intimate activities without pressure to arrive at a specific destination, such as intercourse or orgasm. So most of us, have experienced that lack of appetite when the idea of being expected to eat a large meal can be pretty overwhelming. So imagine you come home and your partner has made your favorite meal. For now, we're going to go and use my favorite meal, which is delicious, heartwarming stew. So you see this large bowl of stew and you think, I'm not really hungry yet. I'm going to try a few bites. So the more you eat, somewhere you think, wow, this tastes really good. I'm going to keep eating this. And soon you finish the whole bowl and you're having dessert. So when you think about your sex drive, when your sex drive is low or when you have changes in your sexual functioning, the thought of initiating sexual intimacy can be overwhelming. It's about starting slow and being open to trying new ways of intimacy together that can be pleasurable and bring you closer. So the next time your partner mentions having a sensate focus night or trying a new sexual aid, try taking a few bites and see where your sexual appetite goes. You can still access joy and pleasure in being sexual, even with low libido. Another way to kind of increase libido or sex drive is called simmering. So simmering is a process of nurturing a conscious thought around something that is sexually appealing to increase your sex drive. So when you go to engage in sexual activities, your mind will be turned on, which can increase arousal. So let's talk a little bit more about that. So the thought can be a previous sexual encounter. It can be from a book, a movie, or a fantasy. Throughout the day, reintroduce that thought back into your mind, like, simmering that thought. And then when you have that sexual encounter, you'll have that thought build up in your mind. Sending sexual text messages throughout the day or watching or reading erotica can be a great way to build up that sexual tension. There are many options out there to kind of stimulate those sexual thoughts.
Okay, so now that we've reviewed everything, we're just going to go over some key points to take home from this presentation. So number one, it is important to communicate, have more open conversations with your partner and really listen to what they have to say. Try not to interrupt and practice active listening. Schedule some time together with your partner for just two of you. You can try creating a passion plan to have more of that intimate time together. You can try telling your partner that you love them and appreciate them every day. Even something as simple as a text message, a little note, or a quick reminder can go a long way. For some, enhancing your intimacy is done with physical contact. So that might look like having a 30-second hug, remembering to have those cuddles, kissing, hand holding, anything that makes you and your partner feel connected and feel good. And remember that your partner is there to support you. So don't be afraid to let them know how you're feeling. Chances are they may need some of your help as well. Everyone needs help sometimes, and that's totally okay. Just as a final note, everything we talked about today are suggestions, right? They're ideas. They're not things that you have to do. It is really important for you and your partner to decide what the two of you are comfortable with and how you want your intimate life to be. Okay. So we have time for questions. I'm just going to turn the camera back on. And then just for the last slide.